for those attendees out there, I'm just waiting to everybody catch up. I can watch people loading as we go through it. So as soon as that slows down a little bit, we'll get started. Okay, I think we're doing pretty good. Some people are still coming in. It's slowed down a little bit, so we'll get tonight's festivities underway. Good evening, everyone, and welcome to tonight's virtual webinar on COVID-19 and the impact it's having on pharmacy in our state. I'm Bob Coleman, CEO of the Georgia Pharmacy Association, and I will also be the moderator of tonight's webinar. Before we get started with our presenters, housekeeping items. One, tonight's webinar is only audio, so if you don't see video, don't worry about it. You should just see a background screen. With 100 registrants online tonight, registrant microphones are muted, so again, nothing to worry about on your end. We can't hear or see you, so PJs on the couch or an adult beverage in your hand is perfectly fine with us. You can click on the Q&A button in the Zoom taskbar at any time during the presentations. Type in your question. Hopefully we'll save time at the end of the presentation to answer your questions. Panelists were given a suggested format, but we're also told to feel free to share any message they felt was important for the audience to know related to the COVID-19 emergency. Our panelists tonight were selected across practice settings in order for us to share and learn from each other. And I also might add all our GPHA members. So it's now my pleasure and honor to introduce our panelists. In the introduction included the details of each of our panelists' distinguished backgrounds and qualifications. We used up all our time tonight. So out of necessity, my introductions will be brief. Chris Thurman, who is president of GPHA, board of directors, and multi-independent store owner. Chanel Doshi, vice president of pharmacy services at Wellstar Healthcare. Susan M. Jackson, executive director of pharmacy system operations in Wellstar Healthcare. Fred Argello, vice president, clinical pharmacy services at Pruitt Health. Jonathan Marquez, multiple independent pharmacy owner and president of the Institute for Wellness and Education. Tracy Dabbs, an emergency preparedness pharmacist with the Georgia Department of Public Health. Greg Rybold, vice president of public affairs and association counsel of GPHA. Quite a distinguished council. So again, thank you for the panelists and thank you to the members for listening in tonight. We appreciate it. Chris, I'll turn it over to you.
Well, greetings. Like I said, thank y'all for being here. For those of you that don't know me, my name is Chris Thurman. Currently have the honor of serving as the president of the Georgia Pharmacy Association. I am a community pharmacist and own a few stores here in the Athens, Georgia area. So I know firsthand the chaos that both the social distancing and the shelter-in-place orders have imposed on community pharmacy. As well as the drug and supply disruptions. It's been very difficult juggling staff, enforcing quarantines among sick employees, and trying not to cross-contaminate, all while taking care of patients. I'd like to welcome you on behalf of the GPHA Board of Directors. GPHA is following government and CDC guidelines and have moved all operations remote. The good news, and I think we can all use some good news, is that GPHA is still able to operate at 100%, and any changes in our daily operations we believe should be invisible to our members. The legislative session may have been suspended, but I assure you that GPHA is still advocating with the Board of Pharmacy, Georgia Medicaid, and both the governors and the insurance commissioners' offices. GPHA's educational offerings have definitely shifted a little bit, but have moved online as much as possible. News and information continues, and I think tonight's webinar is an example of how we've had to adapt to member engagement. Hopefully this will just be in the short term. We are all operating in unique, interesting, and I think we can all agree very challenging times. We put this webinar together to talk with pharmacists from all practice settings to discuss how we're adapting to the COVID-19 emergency, ways we can work together, things we can share in common, share best practices, share concerns we may presently have, and some that may arise in the future. Hopefully we can all learn from each other and have some takeaways from tonight's discussion. In the end, no matter what practice setting you're in, we're all pharmacists, and our patients and their outcomes are what's important to all of us. These are times unlike many of us have ever seen. However, as pharmacists, we will push through this chaos and consistently find ways to engage our patients for their benefit and their good health. Pharmacists, as you know, are amazingly dedicated, and I want to thank each and every one of you for your service to the citizens of Georgia. And I look forward to greeting each of you with hugs and handshakes in the near future. I'd like to thank you, our panelists, for being here, and thank you, the members of GPHA, for taking the time to join us this evening. Having pharmacists from so many areas of practice only demonstrates our strength and validates our place and importance here in the healthcare industry.
Thank you, Chris. Appreciate that. Susan Jackson from WellStar or Well Healthcare, we got you up next. Go ahead, Susan.
Thanks, Bob. My name is Susan Jackson, and I'm the Executive Director for Pharmacy System Operations for WellStar, as Bob mentioned. My purview is overseeing the inpatient operations for our 11 hospitals and trying to keep everybody running in the same direction. We've certainly seen some changes and challenges in the recent days. The first question to address is how we've adapted our practice to what's been going on. And probably the most noticeable difference has been a lot of the pharmacists have come down from their presence in patient care areas on the floors. Unfortunately, to minimize foot traffic in these areas, they've come back down, centralize their operations, and are doing a lot of work from the main pharmacy. However, pharmacists have been very instrumental in making a lot of key decisions in what we'll be using at the highest levels for determining our protocols for care. They're also very integral in prioritizing how our treatments and how we're going to use our resources to the best of our ability. Obviously, our present concerns, hoarding, shortages. The biggest thing is supplies and medications, having issues getting what we need to take care of patients, everything from PPE to Plaquenil and in between. With that also comes issues that we have to be worried about, diversion. We have to treat Plaquenil as a controlled substance, and that's the way it's handled in the facility. It goes in our controlled substance safe along with our other controlled substances and is manually counted back by nursing at the point of dispensing. HR issues, obviously with school out, that creates some challenges. We also have some staff not wanting to go into the patient care areas. Some of the pharmacy technicians not wanting to refill our automated dispensing machines. So we're looking at some various solutions for that. Also have had discussions around remote verification on a large scale within our facilities to allow some of the pharmacists to be able to stay home and use our resources that way to the best of our ability. We are quickly running out of PPE that we need to prepare sterile compounds. That's in general for patient care, but also in the pharmacies. USP has offered some guidance, but there's still a lot of gray area in that. And we've not received any information from the Board of Pharmacy yet outside of referencing USP and other resources of that nature. Day-to-day things, what do we do with our expired medications? Can we get the reverse distributors to come pick them up? How do we handle medications that have been used in the treatment of these patients? What happens if they have to take a code cart in the room? Also, how can we minimize our communications to the nurses so that way they decrease their interruptions and don't have to come out of their PPE in order to answer a pharmacy question? A big challenge, I know all of you are probably familiar that we're having issues with MDIs right now. And however, in the hospital setting, we want to decrease aerosolization as much as possible. So we're looking at ways to use MDIs and tenecteplase and things of that nature in some of these patients. As far as suggested solutions, I think we're all kind of scrambling for them right now. I think probably the best thing that we're looking to do are leverage and share resources as much as we can. We do have 8 retail pharmacies in the system as well, so we're all trying to work together to acquire medications and once again, prioritize and use them to the best of our ability. Also, I appreciate this forum and, hopefully others that'll be going on around the state as a way of sharing information and sharing ideas and best practices. We've seen a couple crazy things come out of this. Everything from creating our own PPE from seamstresses that can sew masks and gowns and caps and things of that nature, to nurses that are using very long extended IV tubing to bring IV pumps out into the hall. And that creates a whole nother set of issues as far as how reliable can the IV medication administration happen. So once again, I think, probably the biggest thing we can do right now is work together, provide a unified voice on some of these issues to the Board of Pharmacy, hopefully get some direction from them, and work together to share information and resources.
Fantastic. Thank you, Susan. That was really good. Doshi, if you'd like to jump in now.
Yeah, excellent. Thank you, everyone. So I'm Doshi. I'm the Vice President for Pharmacy Services at Wellstar Health System. What Susan spoke about today were issues basically beyond our control that she, as our leader in pharmacy, is attempting to bring under control with over 500 pharmacy team members that we have at Wellstar. So with that and information changing every day, my role is a little bit more outward facing as Susan and the pharmacy team here try to curtail, I guess, what's happening within our campuses. So I do look at this, the COVID issue, I guess, for us as an opportunity for all of us to work closely together without boundaries. And I do thank GPHA for taking the first step for bringing us together. Having a unified voice on regulations that we're proposing or changes in business practices that Susan just mentioned here, and I'm looking forward to what the other panelists and our audience, I guess, has to say about this as well, that we make these proposals together in a unified voice. So for example, what Susan mentioned on restricting Plaquenil to be a controlled substance, for example, or restricting how we're dispensing Plaquenil in our retail pharmacies in the outpatient setting. It only works if everybody does it. So for example, how Walgreens and Emory have stepped up to the plate to limit the use of Plaquenil in the retail pharmacies to avoid overburdening the supply chain. So we're going to restrict Plaquenil dispensing for 2 weeks only, COVID diagnosis, and obviously if we have established a relationship with the patient and the patient was already on the drug, trying to reduce it for less than a 90-day supply so that we can preserve the medication, reduce the burden on the supply chain, and get the medications at the hospital where for our inpatient or patients that are admitted to the hospital for COVID, where we can actually leverage these medications. So that's just, I guess, one area. There's a lot of information out there, I guess, or not enough information out there on some of these clinical studies on off-label use of these medications. So I think a lot of our time is actually spent on trying to validate that. So how do we know some of these studies that are coming out from France and China and Italy? We obviously rely on them as they are ahead of the curve in the COVID pandemic. And some of these studies are 6 patients or 8 patients enrolled, and that's really not a study. So how do we all work together here, at least in the state of Georgia, for the off-label use on these potential treatments for COVID, and how are we actually sharing data? So how do we make decisions based on what we know, or how do we build off of what another institution has done in the South, in the North, in the East, or in the West? So that knowledge sharing platform is going to be important. So I joined today not only as a panelist, but as a participant because I myself have questions as to what are you doing for COVID testing? The bottleneck that we have right now is the turnaround times on these tests. So if you're using LabCorp or Quest, I'm assuming that it's taking you 72 hours to get these tests in, and then our action as pharmacy teams begin. So how are you working towards that? So I myself have a lot of questions or unanswered questions myself. So The last statement I wanted to make was that there is a lot of misinformation out there on social media, and it is our responsibility to dispel that and also come out ahead of it by keeping team members in the loop of exactly what is being done in your organizations and resources that are available to them and our patients should they have any questions. So perhaps Greg and Bob, just for fun, a fact checker on the GPHA website. So I'm just throwing things out there, but organizations internally making available like a dedicated web page for your employee, or providing employees the toolkits of all the questions that are probably going through your minds at the moment. What if I'm exposed? What's my leave policy? And also for our community. So I'd be interested to learn more what your organizations are doing, not only to protect the pharmacy team, but what programs and solutions are being made available to our pharmacy team members, and most importantly, to avoid team member burnout. So if I could just leave one last sentence for you guys is pace yourselves. We at Wellstar do feel that this is going to go on for another 6 weeks at least. So this is a unique time for us in the pharmacy profession to make an impact. And that's all from me, Bob.
Doshi, really appreciate that. I'm kind of bummed because that vaccine I just bought apparently is not right. I'll have to return that, I guess. I like the fact checker. We'll see what we can do on that. I'd like to remind the audience out there, you should have a taskbar at the bottom. If you don't see it, hover over the bottom of your window there, and you should have a Q&A section. I've been checking that off and on. I don't see any questions yet. So just to remind everybody, if you want to submit questions, you will see them, and we'll try to get to them at the end of this. So thank you. Next up, we have Fred Argello from Pruitt Health. Fred, welcome.
Hey, thank you a lot, Bob. My name's Fred Argello with Pruitt Health. I'm the Vice President of Clinical Services, and I'm just going to let you know a little bit what we're doing in the nursing home area. First off, because we have a number of nursing homes throughout 4 or 5 different states, we can bounce off. We have 5 pharmacies, so we can bounce off each other as far as supplies and stuff like that. But as far as the nursing homes go, we have a call center set up in our corporate office here in Atlanta, and it's pretty much we got a number of folks there throughout the day, every day, answering questions from family members, staff members, residents to see how things are going and what's going on with the virus. We have set up a system in Pruitt Health that's a code system. So Code Green is a facility that everything's fine and we don't have any issues. Code Amber is a situation where we reduce the visitation of staff that is non-essential into the building, and then Code Red is a level where we have an active patient with COVID-19 that was recognized in the facility and is usually moved to a hospital quickly thereafter, but there has been exposure. So that means we shut down most visitation as far as other non-essential employees or even some essential employees. My consultant pharmacists are one of the employees that would go into the buildings, the different buildings, as well as therapy and some dietary consultants as well. So we're essential and we're non-essential. It's kind of a gray area, but we get shut down so as not to expose ourselves. But if moving exposure from building to building, since we go to different buildings throughout our month, we're just not assigned to one building. And then as far as patients' families, well, we have shut that down completely, and there's no visitation whatsoever. I know that we were in the news, I think our owner and CEO, Neil Pruitt, was on the news, I think about a week ago, where we set up, it was almost like a FaceTime where family members could see their loved ones in the building through that mechanism because they couldn't come in and actually visit them. And that does upset our patients as well as the family members that want to see the patients. We also have shut down deliveries. We deliver obviously to all our buildings 6 days a week. So we have drivers that should go into the buildings and obviously would go from building to building. We have altered the way they deliver the medications. We still deliver them 6 days a week, but they are left right outside the door, and there's communication that as the driver walks away and stands back, the nurse comes out and grabs the tote and goes in. There's not an exchanging of totes anymore. And so whatever, usually we would have a tote come in and a tote leave with information. That doesn't happen anymore either. Any type of food delivery that might have gone on by patients who had ordered something in the past, that has been shut down as well. We right now have, of our 100 facilities, 4 that are code red, all in the state of Georgia, sadly, but larger facilities that we service, which means that there was at least one person that was active with COVID-19 in that facility. And any employee that is in that facility as well that might have gotten exposure right away is taken out and put in quarantine and has to stay away for the 14-day period from work and from anybody else, just to make sure that there's not a spread. We also, as a pharmacy, have Cubex machines in our buildings. Basically, it's an automated emergency kit. So we used to have folks that would come in and fill the kit as it's used. Now what we do is we can electronically determine what is missing from the kit or what has been taken from the kit for some patients, and we will send it in with the delivery, and the nurse now has been given access to replenish the Cubex so that it can be used for patients, in the future. And then the last thing, as far as supply goes, we have not seen a supply issue yet, but we are anticipating we will. We, having the 5 pharmacies in the 5 different states, we have different amounts of supplies in each pharmacy, and had that kind of built up so that we didn't right away have to scramble, but for certain medications for certain patients. But we anticipate that probably will be an issue in the future. As far as drug information, as we hear of drugs that are being tried, we send out drug information to all the pharmacists, both my clinical team, as well as the in-house staff pharmacists, as well as the clinical nurses that go into our building, so that they are up on the medications, the side effects, the dosing that is being tried, the labs that need to be drawn to monitor the medications and the patients. So we send that out to everybody that would need that information in our facilities. And then we also have information if residents are exposed, and employees are exposed, the steps that they need to take because of the exposure to get them back to a clean situation before they would go back into any of our facilities. So that's kind of what we're doing right now on our end in the long-term care arena. And of course, we're very worried, no, not worried, but concerned based on what happened up in Washington, and we're trying to avoid that from happening in any of our facilities in the states we service.
Well, Fred, thank you very much. It's certainly challenging, for sure. Jonathan, you're up.
Thank you, Bob, and good evening, everyone. This has been very exciting, and I wanted to thank you, Mr. President, Chris Thurman, and Bob and GPHA for all you do, and especially putting on this type of conference call. I think this is excellent and exactly what we need. And I always have said this, and I truly think this is a case tonight, hearing from Doshi and Susan and Chris and others, that we are definitely better as a team when we work together. And I know we're all in different practice settings, but there's only one GPHA, and GPHA is for all of us. And I do look forward to any of the discussion we have or questions from the group. As Chris or Bob mentioned, I am a community pharmacist. I'm a past president of GPHA. I'm an NCP officer, but tonight I come just talking as a pharmacist and as an independent owner. And some of the things that we've tried, every Wednesday, the 20 pharmacists that I work with, we get together on a conference call and try to solve problems, talk about solutions and how we can help our patients. And this morning, I'm going to just give you a few of the excerpts that I said. I try not to talk too much on these Wednesday calls, but this morning I did. I certainly learned a new word. I think it's unprecedented. And that's the word I used, that we are witnessing an unprecedented event that many of us did not think we would see in our lifetime. We have definitely not been here before. This is what I stress, and I think this is important, and glad that we're having this call. There is no field manual. There is not a standard operating procedure for COVID. There is no playbook for this kind of event. All of us here tonight, and including certainly our leadership and our group, are having to learn as we go. The purpose, I think that everybody on this call, the purpose of what I basically go to work each day is to keep my employees safe and healthy and take care of our patients, that we can have healthy patients and obviously a healthy business. And one of the things that I'm starting to call our pharmacists, and I think everybody on here tonight, I'm calling my pharmacists community heroes. And I truly think that's what our profession is. There's not a news conference that I hear that doesn't mention pharmacists, and our profession has definitely stepped up. And there's so many of examples of this that we don't have time to go into. And I'd like to certainly thank so many of my pharmacists and technicians that have stepped up, and 99% of them have called me and said, keep up the good work. We're in this. We love this profession. We love helping our patients, and they've enjoyed it. But about a week ago Monday, Pam and I, my wife is a pharmacist, and I know some of the people, the panelists will definitely agree, she really runs our business, but she and I put together a 3-point plan for our business. And we're still really in the phase 1, which is good. And we're cleaning all of our workspaces, phones, desks, countertops, literally almost the whole store. One of my staff members and customer service reps will sort of spray around the store with Lysol every day. I don't know if that necessarily helps, but he really enjoys doing it. So we let him do it. But we are cleaning. We're following the CDC guidelines. We're practicing social distancing. We have put little red X's because the first few days, 2 weeks ago, people would stand sort of close to each other. Our lobbies are still open, but we've now put red X's down in our pharmacy, sort of where you stand right at the counter. Then we'll put 2 red X's that are in chairs that are 6 feet apart, and then 3 or 4 X's of where patients have stood. And today I practiced at Briarcliff Pharmacy near Emory University, and it was so unique. And I wish I would have taken a picture of having the people were actually practicing and doing this. I think we're really taking this to heart. I know there's some out there that are maybe not doing it, but I think in general, the public is taking this to heart. We're all wearing gloves. Many of my staff members are wearing masks. We've also created some signage that basically says, please stay in your car if you have the following symptoms: coughing, fever, sick. So we feel that that's going good. We have decreased our hours, and we're still paying our employees. We're basically decreasing our hours just to rest a little bit and to clean the store more. I hope we don't have to shorten our hours anymore. We've had a full workforce. No one has been sick. No one has gone down in there. We have had a few of my employees that are over 65 that basically have had their family members want them to quarantine themselves, and they keep texting me saying, I wish I was there, but my family won't let me. And we've supported them, and we've encouraged them to do that. One of the things that we have done as community pharmacists with our group, and I'm sure the community pharmacists that are listening, is this has been a great time to promote medication synchronization. And I know Chris has been a big advocate of this, and GPHA and others on the call. Jeff Lurie, I know, is on the call and been a big advocate of this. But, we were probably syncing 20, 30%. We're now trying to sync 50% or more of our patients. And they've actually really caught on to it. So I think we are going to learn from this. I know we're going to learn from this pandemic, and I know we're going to come out stronger in the end. We have definitely, my deliveries have doubled in most locations. One location, their deliveries have quadrupled. So that's put a little tax upon our staff, but we've loved doing it. We are what I would call promoting. We're not only doing curbside. Our lobbies are still open. I know some pharmacies' lobbies are closed, and I'd love to hear from some that have done that and hear some advantages there. But we are promoting curbside. When people call, we're now getting their credit card, and so that we just basically walk out. Many of our stores are in strip shopping centers, and we'll just walk out and hand them. There's plenty of parking As Chris knows, I do have a pharmacy in a downtown, and that's been challenging where there's not really much parking. But overall, I'd like to really commend our staff, our pharmacists and our techs. And I know you could probably name many of your pharmacists and techs that have stepped up. One of my management team is actually calling local pharmacies, independents and chains, and saying, hey, we're here. We'd like to engage. We'd like to discuss. Is there any way we can help? We have transferred prescriptions back and forth. Got one today from Sam's for a patient that needed insulin that we delivered. So I really have enjoyed the camaraderie within the profession. I also have another pharmacist who does not have a drive-through in his pharmacy. So he's made some great signage. He's utilized social media to promote curbside and to texting when they get there so that we can be ready. And I know all of our pharmacists are very, very busy and taxed right now, but I think we're doing a good job in communicating with our patients.
Fantastic. Thank you, Jonathan. Really appreciate that. Just one more reminder. I see the questions keep popping up here on the screen. So keep them coming. We'll come back to those at the end. I think we're running right on time, so we should have plenty of time to get to them. So with that, we have Tracy Dabbs from the Department of Public Health. Tracy, welcome.
Hi, thank you, Bob. Hi, everybody. I just want to say that I am not here as a representative for the Georgia Department of Public Health. I am here as a subject matter expert for you guys. I do want to let you know what's going on in regards with PPE, because I know that's on a lot of people's minds right now. To give you an idea of what I'm doing currently, I am going to the warehouse. If you've been watching the governor's updates and he's mentioning the warehouse, that's the warehouse that I'm working at every day. I'm there for 12 hours a day, working on getting PPE out to the state. To give you an update, GEMA has ordered N95s. We're expecting a large shipment to come in Friday from China. We're acquiring PPE in other areas as well. If those of you who are not familiar with the Strategic National Stockpile, you probably are now. It's a federal asset that has stockpiled not only medications, but PPE as well, N95s and gloves. We have received assets from the Strategic National Stockpile. However, it is a federal asset. Lots of states are requesting it. And we have probably only received about 25% of the assets that we have asked from the Strategic National Stockpile. As you're all aware, this is not only a state issue with PPE, it's a national issue as well. So with that, I just wanted to provide some updates in regards to the Georgia Department of Public Health and give you guys some helpful tips and some helpful links. I've had some pharmacists pose a question to me about a pharmacy employee testing positive for COVID-19. Does that mean that all other pharmacy staff members have to be sent home for 14 days? I reached out to the Office of Epidemiology for their question, and I have sent guidance to GPHA for isolation and quarantine. The answer I received was they should do a risk assessment to see who had close contact during the period when they were sick. Those employees should be asked to quarantine. However, if they have staffing shortages, they can work with a mask and good hand hygiene and a temperature check before the shift. Sick workers should stay home and self-isolate unless they have a pre-existing condition or work or live with high-risk populations, in which case they should call their healthcare provider. I also wanted to pass out information. There is a COVID-19 hotline that is being staffed at DPH currently. I'll go ahead and provide that phone number. It's 1-844-442-2681. Again, that's 1-844-442-2681. I can send these numbers out as well so everybody has access to this. I was actually staffing this call center last week and assisting with calls until I was pulled from the hotline to go assist at the warehouse with acquiring PPE. Also, any pharmacists that have any questions and concerns, you can reach out to a medical epidemiologist, and they suggested that you do that. The phone number for that is 1-866-PUB-HEALTH. That's 1-866-PUB-HLTH. So I wanted you guys to have that information as well. And again, we can go ahead and provide that out via email. Another information site I wanted to share, I had a pharmacist reach out to me with an organization that is matching services that need PPE with people who have PPE. And that website is getusppe.org. That's getusppe.org. And I have had some fantastic success with that. I had a employee from the FDA reach out to me regarding expired N95 masks. Because of the masks that they had, I couldn't take them and dispense them out to hospitals, but they contacted this site and found a local doctor's office that wanted to take them even though they were expired. So they are doing a good job locally matching up with people. I also wanted to recommend the International Pharmaceutical Federation, that's FIP, at fip.org. I have been using this as a great resource for pharmacists in regards to data with COVID-19. They have very helpful tips and suggestions, things that I didn't even think of, like with drug delivery, making sure that you wipe down the totes before they come into the pharmacy, making sure that you're changing your lab coat very often to make sure you don't have contact. On the last note, I do want to say that during this time, I am in awe of the innovation that I have seen in the pharmacy industry. I had one of my friends that put up shower curtains in her pharmacy to protect her staff. And I admire that creativity. I wish I had that, but I do not. I've had friends of mine that are sewing masks and dropping it off at their local health department. And I am just in awe and gratitude of pharmacists everywhere. I appreciate everything you guys are doing. I did work retail for 10 years, so I know what you're going through, and my heart goes out to each and every one of you. I think about you every day when I'm sitting there trying to get gloves where I can get them from, and PPE where I can get it from, and N95 mask out to you so you can have it. This is going to go on a lot longer than we want it to. So I encourage you all to stay safe. And if you need me, feel free to reach out to me.
Thank you, Tracy. Really appreciate that. Thanks for being here tonight. Last up, but last but not least, is Mr. Greg Rybold. Greg, take it away.
Bob, thank you very, very much. And I'll try to move at a good pace to ensure that there's time for questions. What I'm going to do is share with you. This is obviously, an evolving situation, and I'm going to kind of share with you some of the steps that we've seen the state government take, as well as some of the steps that GPHA has taken and is taking, just to kind of keep you all apprised of the work that we are doing. The Governor Kemp declared a state of emergency on March 14th, and since that time, there was a General Assembly specially convened to basically sign off on the state of emergency, and since that time, Governor Kemp has issued 6 executive orders, emergency executive orders. And so some of them, we won't go through all of them, but some of them would definitely like to call everyone's attention to. There was a March 20th executive order reducing regulations. That dealt specifically, amongst other things, dealt specifically with pharmacists being permitted to dispense a 90-day supply of a prescription drug in the event the patient has no remaining refills and the pharmacist is unable to contact the issuing practitioner to obtain refill authorization. It's only allowed to be, the authorization applies once per prescription and doesn't apply to any Schedule IIs. Also included in that emergency order is the ability to dispense early refill prescriptions. Again, does not apply to Schedule II drugs. And it also authorized the Georgia Board of Pharmacy to grant temporary licenses to pharmacists who apply and were in good standing in another state. So that one, again, March 20th executive order. These are all available on the governor's website. And then on March 23rd, Governor Kemp issued an order limiting large gatherings, and there are some implications there. In particular, there's a provision that says no business shall allow more than 10 persons to be gathered at a single location. If such gathering requires persons to stand or be seated within 6 feet of any other person, and there are some health clinics and pharmacies where there could be some concerns. We'll talk more about this later, but we've been in conversations with the governor's office in that regard. But again, this is ever evolving, and we anticipate the governor making some more executive orders as well. We'll speak a little bit more about it, but there's also been some implications with the issuance of 90 days and concerns regarding the supply chain. and we're absolutely in conversations with the Commissioner of Insurance and Governor's office as well. When we say Commissioner of Insurance, that may strike some folks as odd, but he is sort of heading up the task force and the state's efforts in connection with a lot of these things. The Department of Public Health has also obviously been doing a lot of work, and on March 23rd, they issued an amended administrative order for public health measures. The initial order was March 22nd, and that speaks directly to things like isolation for folks who are known to have COVID or suspected to have COVID-19, as well as quarantine for persons whose exposure is likely to result in infection. They sort of define that as close contact within 6 feet for a prolonged period of time. And so, those are really individual specific, not business specific, but one of the things that we are kind of in conversations with different folks across the state are the implications of that administrative order, as well as the March 20th executive order, and whether or not there needs to be sort of some accommodation for essential personnel and maybe expedited testing, et cetera. So that gets us to the Georgia Board of Pharmacy. And the Georgia Board of Pharmacy, again, we've been in several conversations with the executive director. I think she's doing just drinking from a fire hose, as are a lot of folks during this time. But the Board of Pharmacy has really been quite active. On March 16th, on their website, they issued instruction or kind of guidance regarding compounding alcohol hand sanitizer, and they took the position that in light of FDA guidance, Board of Pharmacy is good with that. On the 17th, they issued Policy 14, which deals with emergency refills. I would note that emergency refill that they issued on is really kind of trumped by the governor's executive order on March 20th. So I wouldn't pay a lot of attention to that in particular. And then they issued several other things that day, including the ability for temporary pharmacy technician registration application, temporary pharmacy intern license application, and temporary pharmacist license application as well. Then on March 23rd, the Board of Pharmacy issued emergency rules regarding delivery by mail, as well as remote order entry verification for retail pharmacies. So the Board of Pharmacy, I think has been doing a lot during this time. Again, they're essentially a volunteer board, but they've certainly been convening. We're expecting another rule to be coming down here soon as well. I think it's waiting approval by the governor's office, was the latest that I heard, and we'll talk a little bit about that shortly. And so that's going to bring us to the Georgia Pharmacy Association's actions. And I would note that this whole thing has evolved so quickly. So March 12th was crossover day, and legislative session was still in full swing, and we had 5 bills that all made crossover, and they were contentious bills, big ambitious bills, getting a lot of attention, and all 5 of those made crossover. And then the next day, basically, the governor declared emergency, and our worlds have changed. And so quickly, what we've looked to do is shift and try to obviously represent pharmacists and the public good throughout this crisis. And that involves almost daily communications with governor's staff, Commissioner of Insurance, leadership, Board of Pharmacy, executive director and board members, the Retail Association, the Medical Association. And we've had significant input on a lot of the guidance and orders as well, and we continue to do so. After the governor declared the emergency, on March 14th, we got a letter out March 16th to the Commissioner of Insurance and to the Governor, and again, Commissioner of Insurance in his capacity as task force, making certain recommendations, including dealing with emergency refills, ability of pharmacists to conduct emergency testing for COVID-19, flu, and strep, administer COVID-19 vaccines, as well as emphasizing importance of following FDA guidance in connection with compounding of hand sanitizer products. We've been in communications as well with the governor's office on sort of the COVID-19 cocktails and hoarding and folks writing prescriptions for relatives, et cetera, stockpiling. We've had several conversations with governor's staff as well as Commissioner of Insurance and Board of Pharmacy. A letter was sent out by Department of Public Health on March 22nd, sort of gently addressing the issue. Board of Pharmacy has also taken action via an emergency rule My understanding is that is awaiting approval by the governor. But that's something that's gotten a lot of attention, certainly at the highest levels of the state, and GPHA has worked in that regard to do that. We talked about essential operations. We've been working with the Healthcare Distribution Alliance as well as a few of the big wholesalers to ensure that if there is a statewide shutdown, not only are pharmacy and pharmacists fall within healthcare operations, but as well as drug. And there's been some concern that some states or local governments have gotten that. So we've been having those conversations with governor's staff as well as commissioner of insurance staff as well. We're in communication with the Department of Community Health regarding Medicaid waivers. There's the opportunity states now have for a streamlined 1135 Medicaid waiver process, and I think really importantly included in the CMS waiver is actually something that contemplates an adjustment for home delivery, or basically an adjustment to increase dispensing fee for pharmacies for home delivery and to encourage or enable pharmacies to continue to kind of provide that enhanced service. And so we're in discussions with the Department of Community Health in that regard. Again, the March 23rd executive order, the 6 feet, 10-person limitation, we're in conversations with Governor's office and Commissioner of Insurance's office and trying to see if there's any essential personnel exceptions or ways to address sort of the ability to just allow pharmacies to continue to provide care if they're running into issues. COVID-19, the Department of Public Health, again, issued their sort of administrative rule regarding COVID-19 positive tests, as well as and where they're required to isolate, as well as folks who've come into likely contact where they're required to quarantine. And it doesn't seem, the administrative rule, to contemplate exceptions for essential personnel there as well, or expedited testing. So that's certainly something that we are looking at. We've heard some or seen some examples of audits continuing. Some of those are desk audits, which I think obviously timing is not right there. But shockingly, a few of them we've seen are actually on-site audits, and they're going forward. We know of 2 this week, so that's an issue that we're absolutely working on. We're also working with the Medical Association Medical Reserve Corps to identify volunteers for the Georgia Adjunct General. We've been involved in the signature log issue, and I would note that we've kind of done a fair bit of research and spoken with the Board of Pharmacy in this regard, and signature logs are not a state regulatory requirement, so those are going to be contract driven, and we're going to continue to provide membership updates. We're certainly seeing like CVS and Express Scripts make some accommodations regarding signature logs. CVS's seem to be the most straightforward, with basically just writing COVID-19 instead of getting the signature. So we'll continue to do work on that, but in our opinion, and I think Board of Pharmacy's opinion, I can't speak for them, but I don't think they see a need to take action on the signature log issue, because really Board of Pharmacy rules don't speak to that, with the exception of mail order drugs requiring special handling, and the Board of Pharmacy's emergency rule does not contemplate signature requirements via mail there either. We've had some dealings with refill too soon issues, and we're certainly starting to look strongly at the PPP shortage as well. So those are some of the things we're working on, and again, it's going to continue to evolve, and we're doing our best to stay on top of it. I would close with, certainly always beyond proud to represent pharmacists, but at this time, with the role pharmacists are playing and the work that you're doing and the conditions that you're doing it in, could not be prouder working with and representing you all. And I think GPHA staff across the board feels the same. So we're just so appreciative for the work you're doing and doing our best to try to support you where and when we can.
Thank you, Greg. Really appreciate that. And we've done a great job. We've got, I'm going to try to end this at the end of the hour. So we've got 10 minutes for questions. Greg, when you started talking, the questions went up. I'm not sure. I kind of feel the same way sometimes. Anyway, let's dive into a few of them. Please clarify, this is from David Carver, please clarify the emergency ruling on remote order entry by technicians and pharmacists.
I would say that's going to be a difficult thing for me to clarify. I mean, it's fairly detailed. It is available on the Board of Pharmacy's website, and I can give you my email address, and I'm happy to anybody who wants it, happy to email that to you, and of course share with you my thoughts on it, but probably not the appropriate forum to go into too much detail on that.
Okay, thanks, Greg. Appreciate it. Understand. Okay. See, can Tracy, this is from Susan Rounds, can Tracy please repeat the recommendations surrounding a pharmacist testing positive and what steps should be taken for employees that work within close proximity? I think this comes down to that thing we're talking about with 10 people and 6 feet.
Yeah, sure. So was it, do I just need to repeat the answer for if you have a pharmacy employee that tests positive for COVID-19?
Yeah, that'd be great.
Okay, sure. So per the Office of Epidemiology at Department of Public Health, they state that the staff should do a risk assessment to see who had close contact during the period when that person was sick. Those employees should be asked to quarantine. However, if they have staffing shortages, they can work with a mask and good hand hygiene and a temperature check before each shift. Sick workers should stay home and self-isolate unless they have a pre-existing condition or work or live with high-risk populations, in which case they should contact their healthcare provider.
Thank you, Tracy. Appreciate that.
No problem.
Okay, this one I'm probably going to take around the panels. So I'll pick up a few people here, so I'm just going to call you out by name first, if you don't mind, for panelists. Basically, the person here, this is from Ashish. He's curious how long the panelists are planning for this to be here as far as COVID-19. Tracy mentioned longer than we hope, but curious the time horizons in your organizations. Are we all just focused on the next few weeks? So I'm going to kind of run down the list here. Jonathan, what do you think?
Well, Ashish always asks good questions and tough questions. That's what professors are trained to do. But I don't think any of us know. I'm a little selfish. My daughter's a senior in high school, and I was sure hoping to go to her graduation on May 17th. But I'm thinking about June 1st. I think if we can stop and bend that curve that we've all heard about and do the things we're talking about tonight, I think June 1st, things will get back to quote unquote normal, if there is such a thing. But that's what I'm hoping. Maybe it'll be a little sooner. But for our organization, I'm shooting for June 1st.
Thank you. Doshi or Susan, I don't know if you want to do this together or flip a coin.
Yeah, we can. We can tag team. So short term, the rapid fire, just in time changes, and all the panic management that's going on, we anticipate that to go on for at least another 6 weeks. So that's how we're planning it. But this is going to have an impact on everything long term. Whether we have the financial impacts, whether we have surge capacity issues. Drug shortages that will linger. So we anticipate that should drug shortages occur. So for example, we know India is on a complete lockdown for 21 days. Usually manufacturers have around 4 months of drug supply kind of lined up. So we feel drug shortages are going to happen towards the tail end of the COVID pandemic. So we're getting ready for that. So I think there's more to come. I think this is going to be a prolonged effort. However, short-term panic, we're feeling 6 weeks. Long-term, I'm pretty sure the effects are going to go around for quite some time. Susan, did you want to add anything?
No, I think you pretty much covered it. Otherwise, just to say that, I feel like things that are still kind of volatile as far as how we're using some of the medications and protocols and things that are still being developed, we're trying not to make any permanent or long-term solutions until things settle down a little bit. But yeah, I would say at least 6 weeks and make on some of the stuff planning for long term.
Okay, Fred, how about you? You're muted. Oh, there you are. You're back.
Yeah, we're looking at the same thing as middle of May, end of May. But I really believe that it really depends on the area. Area like New York City, I think it's going to be a lot longer than down here. Just because of the impact. But I agree with everybody else. Long term, it's hard to tell how it's going to affect everybody as we get over it, and then people become comfortable again with what went on. So yeah, that could be the middle of the summer.
Okay, thank you, Fred. Does anybody else want to join in on that? You got a better crystal ball out there?
Hey, this is Tracy. I was supposed to get married in 2 weeks, so I went ahead and canceled the wedding because I knew it was going to last longer than 2 weeks. Um, and I agree with what many of the panelists have said. I am concerned with more, I mean, of course, this is going to last for quite some time. I see it going into April as well. PPE shortages are going to be a concern, however, when we get into the fall and we approach our next flu season. So this is going to take us to a while to recover from that sort of aspect.
Thank you, Tracy. This is from Linda Bearden. Has there been any documented cases of pharmacists contracting COVID-19 while at work? If so, how are they? I can, from a exec side of it, I'm a member of NASPA, which is the state execs across the country. I'm not aware of any that I've heard through the NASPA line, and we meet quite frequently these days, but any panelists heard anything?
Hey, this is Tracy. I can take this one. I haven't heard of any pharmacists, but I've heard of several pharmacy interns that have contracted COVID-19. And I've had pharmacists call and ask me for advice on that. I've been checking up. All the students are at home and they're in isolation and they're doing well.
Thank you, Tracy. Does anybody else have anything to add to that one? Okay, there's one from Aaron Hartage about Doshi's idea about clearing up misconceptions. I'll just speak from a GPHA standpoint. I think that's a great idea, and we'll follow up on that tomorrow and see if we can start making that happen. So thank you, Aaron. I appreciate that one. There was a question about CE credit for this one. I would love to say yes to that, but I'm afraid we're going to have to say probably no. We'll investigate that a little bit more. But in general, for ACPE credit, you have to have 14 days for the course to be registered. And I think we all pretty much know 14 days ago, we were in a different world. So we put this one together pretty fast. I'm not sure they can backdate it or anything like that to make an exception. I think it's a very good presentation, would qualify. But I'm going to leave that to the ACP pros to work on that tomorrow. But in general, I don't want to get anybody's expectations high. I'm going to say no. Let's see. I think Tracy maybe adjust how do you keep pharmacy patients 6 feet apart in an inpatient or outpatient setting? That's probably, I think we kind of hit that. Doshi, or Susan, do you want to talk about that in the hospital setting for a second? You got a little bit more room than most pharmacies, but I'm sure you have challenges too.
Yeah, I think that with utilizing some of the remote capabilities, that'll improve because we can reduce the number of pharmacy staff in the building. However, you know, that's having to really spread the pharmacists out and the technicians to the point where it's probably just not feasible all of the time.
And Bob, can I jump in?
Please.
Yeah, I would just note that the Department of Public Health administrative rule, I mean, obviously 6 feet is ideal, but the requirement for the ability to maintain 6 feet apart doesn't kick in until there's over 10 folks in any business or any business period. So obviously, ideally, you want to keep the 6 feet distance in certain clinics and pharmacies. At times, that's probably just impossible. But the DPH administrative rule doesn't kind of kick in that mandatory 6 feet unless you've got 10 or more folks, more than 10 folks in the business.
Great point. Thank you. Thank you, Craig. Okay, everybody, we are at the top of the hour at 8:30. I promised everybody we would go an hour. To the panelists, I don't know if you've been able to see this, but our attendees have pretty much stayed the same almost through the whole meeting. So I think you guys did a fantastic job keeping interest. So again, thank you to the panelists and thank you to the members for listening in tonight. We greatly appreciate it. Chris, do you have any final words for tonight? Do you want to say goodnight?
Yeah, no, but I just appreciate everybody being here. And I mean, a lot of great information. So I definitely thank all the panelists and all the GPHA members that were willing to give us an hour of their time tonight. Y'all rest well, stay safe.
Thanks, everybody. Have a great evening and stay well. Good night.
Thanks.
Thank you, everyone. Good night.